Assalamu alaikum. Hello, everyone. I hope you all are doing well and welcome to today's webinar. Inshallah, today we are going to discuss and give a quick orientation about our revision or progressive course. And also, I will be here to listen to your questions and answer your queries if there are any, inshallah. Of course, I would like to welcome you all to this webinar, whether you are from our course students or from our other free groups. Of course, we are approaching to the exam, and I know that these days, the stress may be increasing a little bit, of course, especially that if you have work to do and other commitments, the time is somehow strict. So in this webinar, I'm going to first show you what our strategy in the progressive course. I know some of you already joined us and started the discussion, but also I will tell you more about our strategy and what we are going to do next in our progressive course. And then also I will answer your queries about the preparation in the last 2.5 months before the exam, inshallah. So first, I would like to say that me and my dear colleague and friend, Dr. Desiree, we are taking the responsibility of this progressive course. We have 6 live sessions, and we have also all the materials or access to all the materials, whether recordings or PDF or questions. All of that will be available on our website. And of course, we have our own study room. And in this study room, we are doing our discussion. And by the end of the progressive course, we have this very important exam questions workshop where we are going to answer more than 1,000 questions before the exam. So this is the cornerstones of our progressive course. And let me show you our strategy. Okay, and here I would like to make an advice for the colleagues who already joined us, because I can notice that the tempo of the discussion or the participation and the activity is not that expected. Okay, so as long as you joined our course, you have to make time for discussion and answering the questions and discussing with your colleagues, because this is very, very important before the exam. The more questions you answer, of course, the more information you get. And when you do some mistakes while practicing, these mistakes will be remembered, forever. Okay. So we are here in our course to learn and to do our best before the exam. So as you can see in our progressive course, we have 6 live sessions. We have 5 bundles and statistics workshop. Of course, the statistics workshop by Dr. Desiree will be a common workshop between our regular and progressive course. So this is a separate workshop, okay, apart from the other bundles. Each bundle, as you can see, contain 2 subjects, except the last bundle. It contains 3 subjects because biochemistry and immunology are small and minor subjects, so they will be together along with pathology. For each bundle, as you can see, we have allocated time for studying. This is about 1 week, 8 days, 9 days, according to each bundle, okay? At that time, you should study all the topics related to the subjects. Like, for example, we are now already, or we have already started bundle 1, physiology and endocrinology, and we started the discussion. You have the study time at which you have all the access to recordings, and we do on a daily manner discussion in the study room. After that, on Wednesday, like after tomorrow, inshallah, we have our live session. In this live session, we are going to practice more questions and discuss confusing points and also highlight the important points in each subject before the exam. Then after that, on Thursday, you will get an access to a topic test containing mixture of questions of physiology and endocrinology to practice more and more. Of course, in our progressive course, we can say that we focus a lot on the previous exam questions, but divided or classified in a subject-wise way. So after finishing each bundle, we move to the next bundle and so on until reaching our final recalls workshop or exam-like question workshop, which is about 10 days, where we are going to practice the past questions again, but in a yearly manner. So I can say that through our progressive course, we nearly revise the questions twice, but also we don't ignore the theory part, because I know some of our colleagues, when they decide to take the part 1 MRCOG exam, they focus mainly on practicing questions. Yes, I know it's a good strategy, but this strategy is not like a 100% guarantee that you will pass the exam. Why? Because now the policy of the Royal College is that they renew the questions and get new or modified questions. So you have to build up your basic knowledge or make the concepts clear before going through the questions. So in the progressive course, we give you the access to the PDF and theory material along with the recordings to listen to the explanation of the different topics. And then also we make more practice on questions and discuss confusing ones. This is the bundle 1 study schedule, which is already shared and we are already following. As you can see, each day we specify a certain topic to or for which we discuss, and our moderator, Dr. Noura, is sharing questions and discuss with our colleagues, and of course they can share their queries and any point they do not understand, and me and Dr. Desiree can also reply to them at any point if they need our help, of course. And after that, we will take the live session and then the topic test as I discussed with you. And after that, we move to the next bundle and so on. So this is our progressive course strategy. Also, at the end of the progressive course, we have this recalls or revision workshop. As you can see, also these days from 15th of June until 25th of June, like we are going to finish about 1 week before the exam. As you can see, in each day we allocated a certain year for practice. Like from 2024, of course, we are going to start from the most recent exam until the older exams, I mean. Then the last one will be the most recent, the January 2025, because I know that we may face repeated questions in July 2025 from January 2025. So we made it the last exam to practice also. And of course, through this workshop, you are going to get 4 meetings with me and Dr. Desiree. The first 2 meetings with Dr. Desiree and then 2 meetings with me. And in these meetings, we are going to, discuss together about any confusing points and listen to your queries if you have any. And also at the last session, we are going to give the final advice before the exam, how to manage the final days before the exam, and how to prepare yourself, I can say psychologically more than scientifically for the exam. So this is our progressive course, and Alhamdulillah for the previous batches, this course helped a lot those who started preparation late and needed to pass the exam. So I know that now the question, which of course I think in the minds of most of you, that what or how to prepare in the final 2 months before the exam. So this will differ according to whether you already have started preparation before and you already have background knowledge, okay, or you are starting from scratch now. I know that not many people will, start from scratch these days and are planning to take the exam, but if so, we also have a strategy for that. So first, if you are already preparing from a few months ago and you have your background knowledge, so I think you should continue on your strategy. You have to read or continue reading if you still have subjects left without finishing, or if you are already joining our regular course, we are finishing subject by subject. We are taking all the theory points, read them, study them well, then practice questions, and so on. So I think reading, then practicing will be a good strategy for that. Of course, after after you finish all the subjects, of course, you should start revision. And I always recommend that while you are studying, you have to make your own notes. This is very important. Okay, try to make your own summaries, even if you joined our course, okay, and you are studying, try to make the notes of you or in one place, okay. Like, for example, if we are talking about a collection of the events happening in pregnancy, for example, this organ developed at certain gestational age, this hormone start to be produced at this certain gestational age, this element is transferred from the mother to the fetus at this gestational age. So this is a collection of all events happening during pregnancy. Okay, like a summary for the drugs in pharmacology. This drug is, or this antibiotic, its mode of action is 1, 2, 3, and its clinical application is 1, and its main side effect is like 1, 2, 3, 4. This like this, okay? Makes tables, make summaries while you are studying, okay? Or even you can, shoot this notes from the different sources or PDF or books and put them on your cell phone. All I need from you is to gather all the important points in one place. This will make your revision easier at the end, okay? Instead of opening this book and this book and this paper and this note, no, gather them in one place for a better and a quicker revision. Then after you finish each topic or each subject, you do your practice, okay? So this is for the standard preparation. We cannot ignore any of both of the points. Reading or practicing are complementary to each other. But if you are starting later or you will start these days, I think you have to make another strategy, which is, I can say, a reversed strategy, but also for not for all topics. I mean that, for example, if you are taking the first subject, anatomy, for example, okay, and this will be applied for all the subjects. For each subject, we have major topics, which is very critical for us, and some minor topics. Like, for example, in the anatomy, of course, the major topics will be the anatomy of the anterior abdominal wall and the female genital system, okay? And other minor topics like anatomy of the breast, for example, male genital system, anatomy of the bladder, for example, and the ureter. These are minor topics. So if you are starting late, At least try to go through the major topics, reading and summarizing quickly, and then do the practice. Okay. Of course, when you practice, you will face other questions about the minor topics. So this is when you are going to do this reversed strategy. When you practice, you will get a new question, you will search for the answer, and note down this information. Like the bladder is, for example, lined by transitional epithelium. And just I'm giving some examples, I mean. So if you are not knowing the information, you are going to note that down. Okay, but you will get this information by practicing the questions, whether from the books or the question banks, or also from the previous exams. Okay, so this will be applied for each subject. For example, in the pharmacology, okay, pharmacology, we have a lot of topics, but at least you should study the drugs or related to the hormones, hormonal treatment, for example, in the gynae practice and contraception. This is very important for the practice, okay? And also you will study drugs related to the uterus, because these are major topics related to our practice. But when you come to a point like, for example, the antiviral drugs, okay, or even the antibiotics, okay, to know the side effects and so on, you might get the important points from the questions. Like they ask frequently about the side effect of tetracycline, which is the yellow teeth, for example, or they ask about that streptomycin cause sensory neural hearing loss. This is a frequently repeated question. Like that, you will get this information from repeating the questions. So this strategy will help you a lot if you are starting late or you are going to start from scratch these days. Okay, and to know more about these topics, of course, you can access our free group on the Facebook. I already put all the topics there for each subject. Okay, our MRCOG Part 1 guide group, MRCOG Part 1 guide group on Facebook. You get a featured post there. I put all the information for each subject. You will check the topics related to the OB and gynae practice. Try to read them from the sources already. I wrote there also. I wrote there the sources of theory books and question books. You can get the information from there. I'm talking if you already not joining any course and you prefer studying with yourself. But of course, if you are one of our course colleagues, you don't have to look at the books, because we gather the information in one source, which is the PDF materials we share on our website. Of course, I always say this advice that you have to study on a daily basis, okay? Studying on daily basis is important, even if you have some work to do, or if you have a hospital shift or your private clinic, whatever, make at least 1 or 2 hours per day to read, or to at least look at the discussion in the study groups, whether the free groups or the course groups. Also, don't be ashamed to share your questions. Okay, we are here to learn. Okay, so even if you think that this question is very basic, okay, and very simple, and you still feel that it's confusing for you, share it with us or with your colleagues in the study room or the study groups. This will help you to retain the information and solidify the knowledge you have. Okay. Also, don't try to distract yourself in a lot of groups these days. Okay. I know that there are many groups everywhere discussing MRCOG in all parts, part 1, part 2, and part 3. And of course, many groups are beneficial. I can't say that these groups are bad groups. Of course, there is much respect to all our colleagues everywhere. But I'm just telling you not to distract yourself, because I think the information will be repeated. So don't try to join like 5 or 6 groups. It's enough to join 1 or maximum 2 groups to look at the discussion. Okay, collect your notes in one place, as I told you, and if you help the others, of course, this by an indirect mean will get the help to yourself. And of course, remember your aim every day and work hard for it. Guys, I always say that we take these exams by our, own will. Okay, no one forced us to take these exams. I mean that some exams we are forced or obliged to take. Like for me, for example, I'm in my country, and to be a specialist, I have to take a certain exam to be able to work and to be able to have my clinic and so on. Okay, so I'm forced to do that. But when I come to MRCOG, I took this exam by my own decision. No one forced me, or I don't have, something to force me to take this particular exam, except that I want to improve myself, okay, and have another, chance if I want to travel, or if I want to, have an extra chances in my work, or extra development and promotion in my work. So these exams we decided to take by our own will, and for that we have an aim and we should work for that. Okay, but at the same time, I don't want you to put much stress on yourself. Okay, because we are in this life are trying and doing our best. Sometimes we face obstacles, but then we stand up again and we complete our journey and so on. And this is important for us. Okay, as I always say that the final aim that we want to be good doctors. Okay, yes, we want money, we want positions, we want to travel and so on, but at the end you have to make the the final aim, or the highest target for you is to be a good doctor, to help people well and to guide them well. Okay, so if this exam won't make you different from other colleagues who just practice and make the abuse of drugs and information and so on, so I think there is no need for this exam. Okay, so it's important to make this like an important target, and aim to you, that I want to be a different doctor. Okay, I want this MRCOG exam to reorganize my mind and reorganize my ideas, and I want to think in an evidence based way, not to prescribe medications and strategies for people which are not evidence-based. Okay, that's I always say that. And I already felt this difference when I finished MRCG. Uh, Complete difference between myself before the MRCG and after the MRCG. Okay, and not only the MRCG. If you are if you want to take any other exam, if you have any other targets, okay, or any other countries you want to travel to, I mean that when you take this international exams in general, this should reorganize your way of thinking and your way of approach to the cases and to the patients. Of course, these are some of the different books we have. If you want to have some, of course, like the revision notes, essential revision guide, basic science, Dr. Recha book, and the Philip Bennett book. And these are the practice books. Unfortunately, for part one MRCG, that the practice books in the market are not many. Like part two, we have a lot of practice books in the market, but for part one, they are limited, unfortunately. So we depend mainly on the previous exams and other question banks. And of course, we have our own question bank in Mid-Exam Expert. Also, in part one in MRCG, we have integration of some clinical points. We get these points from the NICE Green Top guidelines, some from the PASH guidelines for microbiology, and also some topics from the TOGS. But as I told you, in the courses, we already gathered all this information and we put them in one place for easier access and study. Of course, in the study room, whether in the regular and the progressive course, we have full support by the IT team, by the backend team, by the moderators and mentors, daily discussion. You will get all updates regarding the exam and announcements, and you will have all the access of all materials till the exam time. Also, this is applied also for the website. When you join us, of course, you will have access of all materials until your exam. You will have access to the recordings, whether the pre-course lectures, and the pre-course lectures are some topics we already recorded to save some time in the live sessions. You will have access also to the live session recordings in our progressive course. You will have the PDF materials. You will have the topic test, mock exams, and also you will get access until your exam, inshallah. So this was quickly, an overview to the strategy of revision and the course we are going to follow these days. And I think for such webinars, I prefer to listen to your questions and queries if you have, of course. So I have a question already. Dr. Zena is asking me what is the difference between the regular and progressive course. Okay, in the regular course, it's a long course. We already started a long time ago. We are about to finish it actually. Okay, so it's like going in through the studying like step by step. Okay, and we do like a systematic way of studying. But in the progressive course, we have like this is a condensed course, only 2 months and a half, and it include revision. Okay, in the live session, we are not going to discuss topics. You just listen to the recordings, okay, and you study the theory part, and then we revise this. Okay, revise this by the live sessions or by the live session of the bundle. We revise the important questions, and then you have access to topic test. So it's a condensed course and more depending on questions rather than going through the theory part in details. But also you will have the access to the theory part because we cannot discuss and practice without having a background knowledge. So this is the difference. Also, the progressive course include the revision workshop, but the regular course doesn't include this revision workshop. Dr. Aishi is asking if you are starting to make notes according to the progressive course timetable, will we be able to pass the exam? Yes, of course. If you do daily studying according to the progressive course table, you are going to finish and be able to pass the exam, inshallah. Okay, so that's why we allocate a time for studying, and we share questions on daily basis. Okay, so this is very important. If you follow the timetable on daily basis, you are going to finish all the subjects and you will be able to take the exam, inshallah. Dr. Samar is asking, does the exam have MQs? No. This is in part 2. In part 1, all are single best answer. Dr. Shams is asking, if I am taking regular course, do I need a progressive course? I think this is something you should evaluate yourself, okay? Why? Because some people, okay, uh, why people need a course from the first instance? Why? Because some people already are busy with their own work and own family commitments and so on, and they want to be followed, okay? And they want something, to follow, and they want commitments to do, okay? So if you think that you are now satisfied with all subjects, and when you try to practice questions, you feel that you understand all the points, then I think you are satisfied. If you still want to be followed up until the last day before the exam, so this is really an individual decision, okay? Also in the regular course, we are not leaving the colleagues after finishing, okay? But at least we are going to give them a guidance of how to revise before the exam if they are not joining the revision course. We will have mock test in the end. Yes, there are mock tests on our website you can practice. So, but of course, we will focus more on the previous exam questions. No, the progressive course is a separate course. It's not a part of the regular course. Dr. Gamal, are recall sufficient with one of the sources like MRCOG notes to pass it? Mm, I don't like to say yes and no for these questions because yes, I think doing one book beside practicing questions is, I think, a good strategy. But the problem with MRCOG notes book in particular, that this book is old somewhat and not updated, and there are some information that you need to get from like some guidelines. Like, for example, we need to know something about management of postpartum hemorrhage. We need to know something about the placenta previa and placenta accreta, something about, chickenpox and pregnancy, thromboprophylaxis in pregnancy. These points are not found in basic science books, okay? These are clinical points and they come in the exam now. So we have to at least read some of these clinical points, and also the topics. If you are not part of the course, the topics are written there in the free group if you want to have a look. No, no, house job is not necessary requirement to book. All you need for taking the exam is your graduation certificate only. Dr. Kiran is asking if starting studying from today. Yes, if you are following the course, you will be able to finish, but at least try to double your effort. Okay, I mean that if you didn't or you haven't studied the first bundle, you will start from the second bundle. I mean, you will like double your effort to get finished with the first bundle. Okay, because once we finish, you will have only time for the revision workshop and then just few days before the exam. But if you already finished the first bundle, then continue with us the remaining bundles, but do your best every day. I mean that when we say you have today to study ABG and calcium homeostasis, then you have to study them well, okay? Uh, Dr. Shah, you took the regular course and you're appearing in January 26th. It's still a long time. Okay, if you take the regular course now and you're asking about a study schedule, okay, you have a lot, you have long time for January 26th. You can repeat the same strategy we gave you in the regular course, like you study the PDF. I mean, study the theory parts. I mean, then practice the questions. Guys, make sure that you close your mics because we don't want to affect the recordings. So follow the theory part, then practice after each subject and finish all the previous exams, okay? And then before the January 26th exam, then you can take a revision course. If you want like a final revision before the exam, then you can just join us in the progressive course if you want to make a final revision. If I'm recommending a certain book, I will recommend Essential Revision Guide and Basic Science, Oxford Basic Science, okay? Because these books are somehow updated and contain good information, okay? But if you are joining the course, please don't distract yourself because I already read the books and summarized the information and reorganized them in the PDF, of course, me and Dr. Desri, okay? No, if you are in the course, don't try to distract yourself by other question banks. Okay? No, the important exam questions are part of both courses. You will get access to the previous exams in both of our courses, regular and progressive. Don't worry about this. Is 2 months preparation. We don't talk about months, okay? Months or days. I mean, how many hours you can get per day, okay? Like, for example, if you are working like 12 hours per day and you have work every day, for example, and you just take one day off per week, for example, I'm just imagining, okay, and along or during your routine or during your job you cannot read, so it will be difficult for you, okay, because you need at least 4 to 5 hours on daily basis to read and study well, okay. So this is according to your routine, or if your job is not like hectic and you can have or can you make time every day like 3 4 hours to study, then I think it will be enough for you. Okay. For the guidelines for part one, of course, you will not read them thoroughly and in details. Just look for the recommendations. Okay. Don't read the details under the recommendations. Just look at the recommendations quickly. And also, if there are algorithms or tables inside the guideline, this will be easier for you to gather the important information. Okay. But don't read all the details. All the details should be read for part two, like the explanation of each recommendation and so on. This is mainly for part two, and all you are not going to read all the guidelines. Okay, they are all like 10 guidelines for maximum for all the or 10 to 15 guidelines for part one. Okay, not the entire guidelines. Okay. The backend team already are sharing the links. If you need to discuss anything about the joining, you can contact them. Dr. Mohammed is, I joined Progressive course only 4 days ago. I would to confirm all study material on your website. I'm missing some topics. Okay, the backend team already opened the access to you for everything. Okay, so just revise the access with the backend team. Contact the backend team and make sure that you have access to everything. They will tell you what are the points or the materials you have access to, and make sure that they are all open for you. Okay. Yes, inshallah. Don't worry. We are going to guide you, okay? And all we need to do is that you follow the schedule. Our part is to provide you with the materials and summaries, and as I can say, we try to make your life easier, okay? But also you have a role to do, which is to study on daily basis. Okay, if you finish your commitments on daily basis, you will be able, inshallah, to finish everything and take the exam with ease, and you will pass, inshallah. What will happen to those in the regular course? Yes, you will get access. As I told you, we will provide you with a revision schedule. Okay, you make me feel like we are going to leave you. Okay, no, don't worry. We will give you a revision schedule to follow. Okay, and you will get access also to the past papers to answer, and also if you have any queries, you can share in the study room, and we will answer you, of course. Okay. Any more questions? No, we make our study room on Telegram because Telegram, save all the materials and things we share. So if you even join the group late, you can see all messages. But WhatsApp doesn't have this feature. So we make our study room on Telegram. Dr. Danish is asking, is 2 months enough for passing exam with hectic job? Okay, also answer me, how many hours you can have per day to study? This is the thing you have to answer. Okay, can you make like 4 or 5 hours per day to study or not? Hardly 2 hours, and starting from scratch. For July exam, it will be borderline. Okay, I don't want to make you like give up. Okay, but if you are starting from scratch, okay, I think this, will put you under stress, too much stress. Okay, I don't know. I don't know if you already paid for the exam or not. Okay, but um, I think if you won't be able to make more hours and you starting from scratch, um, myself recommend you to wait maybe for January. Okay, but if you want to take the risk, it's okay, but at this point you have to, focus more on practice. Okay, and try to read the important topics quickly. Okay, to gather as much information as you can. Did you pay for the exam actually? Or I mean, did you? Yes, I think this the booking window haven't opened yet, but I think just the expression of interest, which is already finished. Yes. So I think before booking the exam, evaluate yourself. Okay. Again, reevaluate yourself and your condition, because unless you are obliged to take the exam in July, but I think if you are not rushing for something, you can wait. Oh my God. I forgot the calendar maybe, but I don't know. There are some questions you have to answer yourself. But I myself, I will not advise to put yourself under that much stress. 2 hours per day, starting from scratch, and there is nothing to rush for. Okay, why not you take your time? Okay, because at least this is money will be paid. You don't want to, waste your money. Okay. I'm honest with you. Okay, I don't want to give you false hope. I mean, but some people are, prefer to taking risks. Like, I'm going to take the exam. I'm going to do whatever it takes to take the exam. I will start reading whether in my. There are some people can do this. Okay, I myself don't prefer to put myself under stress. I prefer to take my time in each thing I do. Okay, Dr. Kiran, this session is recorded. Okay, so don't worry, you can get access again to the recording. Dr. Summer, okay, if you join the course, inshallah, you will be able. Okay, I, I want you to make these 4 hours pure studying for you. Okay, and in the remaining day, okay, or the remaining time of the day, at least look at the discussion in the study room. Okay, so if you have 4 hours, makes these 4 hours for you. Don't distract yourself by groups or something like that. At these 4 hours, read the topic and study. Okay, then after that, while you are doing any other routine or something like that, just hold your cell phone and look at the questions shared and read the discussion. This will give you more information, and also do the topic test and attend the live session, or at least listen to the recording of the live session. And this, inshallah, will help you to pass the exam. بإذن Regarding the lectures are all found on the website. All the recordings for all lectures are on the website. Okay. The passing score for the exam is not fixed, but um, it never exceeded like 68%, 67%. Maximum, I always say, like, we have to aim for more than 70%. This is for passing the exam. But again, when you aim for 70%, God forbid, you might get 65%, okay? But when you aim for 80 or 90%, you will get, 75, 85%, okay? So just try to get as many information as you can, and practice as many questions as you can, as if you want to get 100% in the exam, okay? But inshallah, those who score 70% or more in the exam, of course, they are going to pass it. All recordings are available, okay? For all subjects, for everything we already gave, it's available on our website. Any more questions, dear colleagues? No, ECG learning is not important for part one. I can say it clearly. When it comes in the exam, it's only one question with 1 mark, and it's very basic question, okay? And we also give this information in our course, the important points which can be asked in ECG. But to learn ECG like you are a cardiologist, no, of course no. CT scan also is not important. Guys, if you when you have like a question like in the data interpretation, okay, you usually get a clinical scenario, okay, beside the picture, especially when we talk about CT, MRI, or something like that, okay, you usually get a clinical scenario, and we usually answer the question from the clinical scenario, okay. The image is just a complementary thing in part one MRCG. It's not mainly necessary. I'm not saying for all questions. Some questions you have to look at the picture and you get the diagnosis, but these are very clear things, okay. But for complicated or I mean advanced imaging and some things like that, you will get a clinical scenario which will help you to answer the question even without looking. But to also have the professionalism in reading a CT scan or an MRI, no, you are not a radiologist, okay? Any more questions? You mean that you got the picture without any comments or clinical scenario, CT abdominal pelvis? I don't think so. There should be a clinical scenario. Dr. Mohammed Zahid is asking about members of regular group. What about us? How we prepare MSc? Like I previously answered this question that for the regular course members, if you are not in the progressive course, it's okay. You will get a revision schedule, okay, after we finish all the subjects, and you will get access to the previous exam questions on our website, okay? The questions are there and answered also, so you can prepare from them. From the start of the course, they told us they will provide us 1,000 MCQ. Okay, Fatima can respond to this. I haven't said anything. I think they may they mean that you will have the access to the recalls, okay? Maybe, okay, but Fatima can clear this information. You can contact Fatima, okay, and she will answer your queries, okay, Dr. Muhammad? Okay, Dr. Shah, if you can share the question with me, I will look at it, okay? But I have never, no one before told me that there was a picture without a clinical scenario. But let me look at the recalls, okay? Any questions? I'm waiting. So that's it. Okay. I think no more questions. Uh-huh. See, when I start ending the session, I receive questions. Okay. Dr. Mahreen, are you studying alone or you are a member of the course? No training is needed for part two. You can join immediately, or you can take the exam immediately. The 4 years experience is needed for part three only. Okay, but for after part one, you can take part two immediately. Yes, you are in our course. I mean, so why you want to check books? I mean, the PDF are enough, more than enough. So, Dr. Samar, yes, you can take part 2 immediately, okay? No training is needed, I mean. For the gap, there is no certain gap between part 1 and part 2. Once your result appear in part 1, you can apply for the next part 2 exam if the next part 2 available exam, okay? You of course should make an expression of interest. You can book for the exam immediately. But if you mean how much time needed to study, part 2 need at least 6 months. Need at least 6 months pure studying, okay? Interval between part 2 and part 3. Also, this depends on your experience, okay? First, let me answer Dr. Ofunir. Please contact Fatima, okay? She will guide you, okay? Regarding the interval between part 2 and part 3, part 3 needs an experience or training of 4 years in OBS and gynae. So if you already finished your training, you will send an application form with your experience certificate. It's called the assessment of training form. You are going to fill this form and sign it from your consultant, okay? And along with your experience certificate from the hospitals you already have or got your training within, okay, then you will be eligible for part 3. But if you are still having the training, you should continue 4 years at least to be able to apply for part 3. Part 2 need no training, Dr. Mahrin. Need no training. You can apply immediately. You don't need anything for part 2 except to fill the expression of interest form and book the exam, okay? Again, part 2 need no training. If you have more than 4 years experience in gyno and ops, then you are eligible for part 3. After passing part 1, all you have to do is apply for part 2 immediately. Just book for the exam, take part 2. Then after part 2, send the assessment of training and experience certificates and so on to be eligible for part 3. Thank you, Dr. Malin. God bless you too. Thank you. My pleasure. Any more questions? Dr. Shah, again, part two need no experience. You can apply immediately. Okay, you are working, mashallah, since 2015, mashallah. So, of course, you are eligible for part three. Okay. But part two, guys, no training. I mean, no papers needed at all. Okay, you just go to your account, fill the expression of interest form, send the money, and that's it. Okay, even you are not sending any papers. Okay, once you are eligible for part one, you are eligible for part two. Okay, you are welcome. You are most welcome. Thank you. Okay, thank you so much, everyone, for joining me in this quick short webinar about our progressive course. And I hope we could answer all your queries and questions. Still, if you need any help, of course, you can just send a message to our WhatsApp group, and the backend team will help you immediately and answer your queries, whether they are related to the exam booking or papers needed, or everything related to the scientific part, I mean. I wish you all the best of luck. And for my dear colleagues who are going to join me in the progressive course, I will meet you, inshallah, after tomorrow, discussing our first bundle, physiology and endocrinology. Have a nice day, everyone. Thank you. See you. Bye bye.